Good morning, friends. Welcome to The Bright Side. I am Pharmacist Ben, and thank you for being here. Our number, 844-236-6010. If you have questions, comments, success stories you'd like to share, if you just want to contribute to the conversation, 844-236-6010. We're here for you, and we love hearing from you as well, 844-236-6010. If you want to purchase longevity products, go to brightsideben.com, pharmacistben.com, or criticalhealthnews.com. You can also sign up to join the Brightside Ben team off the websites, brightsideben.com, pharmacistben.com, or criticalhealthnews.com. And you can also call 866-735-2470, 866-735-2470 if you want to speak to a real-live human being, if you've got questions, or if you want to sign up to join, or if you want to place orders, you can also call 866-735-2470 to place your orders. Our number, 844-236-6010. On the bright side, we'll get your calls in our second segment. We'll be speaking to Dr. Jack Zamora, oculofacial plastic surgeon and a pioneer in plasma treatments and stem cell technology for beauty and anti-aging. Dr. Zamora's got some really interesting things to say about exosomes and stem cells, and also about the vaccine, the vaccine, capital T, the vaccine that everybody's talking about. We'll get to Dr. Jack Zamora at the bottom of the hour, and we'll get your calls in our next segment, 844-236-6010. All right, I want to continue talking about this, aging pigment, the waste pigment called Lipofusion. We started talking about that on our last Bright Side episode. We've talked about Lipofusion in the past. I think it's a very important marker of health, or the lack thereof. It's an important marker for aging. You don't hear a lot about Lipofusion. It's not something that most people, or even most physicians, understand. Lipofusion, the pigment of aging, is a dark yellowish substance that accumulates in various tissues of the body, especially the heart and the brain and the eyes, the digestive tract. The tissues that work the hardest tend to have the most accumulation of this aging pigment, which makes sense. Lipofusion is the end result of cells that are overworked, cells that are dying, and cells that are not able to clear out their waste as effectively. So it makes sense that the cells of the body that are working the hardest, that is the cells of the nervous system and the cells of the digestive tract and the cells of the brain and the cells of the skin, would be the areas that the cellular areas where you'd find most of the accumulation of lipofusion. Macular degeneration, for example, one of the leading causes of blindness, is linked to the accumulation of lipofusion in the eyes. There's a lipofusion connection to Alzheimer's dementia, even though it's the amyloid plaques that get all of the attention. Lipofusion has a sort of brownish tinge to it, and you'll see it in the skin. It's very, very common in the skin. It can appear sort of like a very light to light brownish color. It looks different than ordinary pigment, although it gets confused with ordinary pigment. Under ordinary circumstances, as these cell components, the substructures that are inside of cells, age or they're recycled, they get transferred into little organelles called lysosomes. The lysosomes are the chemical incinerators of the cell. These lysosomes are supposed to oxidize these components, and then the components get recycled and form new organelles. And then when cells die, these waste materials will eventually get dispersed into various parts of the body. Hopefully the lymphatic system, it will clear out lipofusion. That's what's supposed to happen. That's why lipofusion accumulation doesn't occur when you're younger, because the lymphatic system, the body's sewage system, is typically working fine when we're young. As we age and the lymphatic system gets clogged up, or as the bowels get clogged up, as cells get more tired and dysfunctional, and lysosomes don't work as effectively, and lysozymes don't work so effectively. The lysozymes are the enzymes in the lysosomes. Eventually, this pigment starts to accumulate. Lipofusion, by the way, can also accumulate in the case of a rare class of diseases that are called LSDs, or lysosomal storage disorders. These LSDs, lysosomal storage disorders, are associated with what they call inborn errors of metabolism. That means basically you're born with a genetic anomaly. An inborn error of metabolism is when you're born with a tweaked genetic set, with some kind of tweaked genes, and this results in the formation of defective lysosomes. There's a disease called Tay Sachs disease. That's a classic example of a lysosomal storage disorder where lipofusion will accumulate. Gaucher's disease, Fabry syndrome. These are all lysosomal storage disorders. Fortunately, they're very, very rare. They only affect maybe 1,000 newborns a year in the United States. There isn't much you could do if you have a lysosomal storage disorder, and if you, God forbid, are to get one, you can expect to have if you have one, you can expect to have a dramatically shortened lifespan. And this really highlights the very critical nature of this waste disposal system, the lysozyme incinerator, if you will. And while lysosomal storage diseases are rare, the inborn error of metabolism, the ones that you're born with, as we get older, many of us, if not most of us, will begin to manifest the signs of lysosomal incompetence, lysosomal breakdown. And the most important and obvious sign of lysosomal breakdown is the accumulation of lipofusion. So yes, it's true that these lysosomal storage disorders are very rare, but as we get older, in a way, we're all suffering from subclinical lysosomal storage disorders that don't make you sick enough to go to the doctor, but will accelerate the aging process. And not only is lipofusion a sign of aging, it itself can accelerate aging. Lipofusion itself can be a problem. So it's not just cosmetic. It's not just an appearance. In the skin, it's cosmetic, but inside the body, it's not just the appearance of lipofusion that's a problem. Lipofusion itself can accelerate aging. And it does occur in the heart, it occurs in the digestive tract, the brain, the nervous system, the eyes, because, as I say, these cells are so hard-working and susceptible to damage. But the most obvious appearance of lipofusion, the aging pigment, is going to be on the skin. And these deposits, these lipofusion deposits, can be very misleading. And if you're not aware of this phenomena, if you're not aware of this substance, lipofusion, and many skincare professionals and most patients are not aware of it, you're going to confuse it with pigment, with melanin. And you're going to try to use skin lighteners, and you're trying to get chemical peels, and you're going to think that you just have these pigment spots that are related to the sun. You may wear sunscreens and stay out of the sun. But this is not the same. This lipofusion deposits, lipofusion pigment deposits, are not the same as melanin. Melanin is pigment that is associated with stress, specifically the stress of the sun. And melanin hyperpigmentation can be a problem. In fact, it's one of the biggest problems that estheticians confront and dermatologists confront as we age. Melanin, like lipofusion, also tends to accumulate, and it also accumulates in blotchy spots. And this has to do mostly with our hormones, our steroid hormones, cortisol and estrogen, our food choices, nutritional deficiencies, and poor stress management. Notice I didn't say stress. I said stress management, how we handle stress. This is melanin pigment, and this needs to be distinguished from lipofusion pigment because the treatments are different. And you can actually tell by looking at the pigment. If you know what you're looking for, you can actually tell the difference. I'll talk about that when we come back from our break. I'll tell you how you can tell the difference between lipofusion and melanin. I'm Pharmacist Ben. You're listening to The Bright Side. We'll be back right after this. Back on The Bright Side. I'm Pharmacist Ben, and thanks for being here. 844-236-6010 is our number. We'll get your calls in just a sec, so hang tight. We're going to talk to Dr. Jack Zamora about stem cells. Stem cells for beauty, non-invasive beauty treatments. Dr. Zamora is an oculofacial plastic surgeon. He's a pioneer in plasma treatments and stem cell technology, and he uses stem cells in his clinic for folks who are dealing with wrinkles or fine lines or thinning skin. And he does some really interesting work. His website is jackzamoramd.com. He's also a pretty well-rounded guy. We're going to talk a little bit about the vaccine. He told me something very interesting about the COVID vaccine, and when he told me, I said, you got to come on the program and talk about that. So we'll have Dr. Jack Zamora coming up at the bottom of the hour. We'll get your calls here in just a moment. I want to touch on just a couple more things. We'll be talking about lipofusion and also the lymphatic system, which is the most important area of the body to concentrate on if you want to take care of lipofusion, as opposed to melanin. Melanin and lipofusion are both pigments, but they're different, and they require different treatments. They appear differently. They appear differently. They look different, and they also appear on different parts of the skin, in different parts of the skin. The lipofusion tends to be deeper. Melanin tends to be higher. Melanin is tanning pigment, and lipofusion is aging pigment. As we get older, our tanning pigment, our melanin, starts to appear blotchy. It doesn't occur like an even tan. It occurs blotchy, and still, to this day, there are still people, and estheticians, and skincare professionals who should know better, who tell you to stay out of the sun to prevent this blotchiness. This blotchiness, this hyperpigmentation, it's technically called melasma, does not appear because of the sun. It doesn't show up because of the sun. You get tan from the sun, but you don't get blotchy from the sun, or you shouldn't anyway, get blotchy from the sun. If you are getting blotchy from the sun or getting blotchy in general, you don't want to blame the sun. You want to blame your stressed out system, your stressed out melanin system. And usually that involves hormones, estrogen and cortisol specifically, and it can also involve nutritional deficiencies, as we talked about earlier. You can tell the difference between melanin and lipofusion by the depth. Melanin is superficial. It's on the surface of the skin, while lipofusion tends to be deeper. Lipofusion also tends to have a brownish color to it, while melanin tends to be darker. And melanin pigmentation will slough off, while lipofusion will not. And there are a couple things you could do if you're dealing with lipofusion. Most importantly, you want to take care of the lymph, but if you do go see a skincare professional, they can use a laser to get rid of the lipofusion. As I say, lipofusion is located deeper in the skin in what's called the dermis. We'll be talking more about lipofusion as well as melanin and hyperpigmentation and what you can do about it. When I say hyperpigmentation, I'm talking about melanin. Hyper meaning too much, pigmentation meaning melanin. Hyperpigmentation, aka melasma, is one of the more common complaints that people have about their skin, and one of the more common reasons why people will go to a dermatologist or an esthetician. And there are wonderful things that you can do to help protect yourself, or help eliminate melanin and hyperpigmentation, that is, and also to protect yourself from getting further hyperpigmentation. Most of these strategies will involve nutrition as well as stabilization of estrogen and cortisol. We'll be talking about that in our coming Brightside episodes. Time to hit the phones. 844-236-6010 is our number. Let's go to Coroziano. I think I said that right. Good morning, Coroziano.
Hey, Bennett. No,
it's Graziano. Graziano. Yeah. Oh, it says Coroziano here on my computer.
No,
what's going on, Graziano? Long time no talk.
Yeah, I was just calling another feel-good story about my younger brother. You've actually spoken to him years ago, but you wouldn't remember.
I do remember talking to him. I don't remember his name, but I remember talking to him.
Yeah, he was questioning one of the ingredients in the BTT. But at any rate, he's got some gut issues, and so he was dealing with diverticulitis. Got surgery and still deals with it. So,
what kind of surgery did they take? Did they take some of his colon?
No, I don't exactly know what. I just know he went in. I think it was just in his gut. I don't know if because I guess you get pockets in the intestine or something, and seeds get in there. I think, right. So, but anyways, he's still fighting this. So I said, you know what? You gotta listen to what I'm talking about, what I hear from Brightside Ben all the time. So he was fine. All right, fine. So I told him, look, get some glutamine. Take glutamine every day. Take the BTT, take some probiotics, digestive enzymes, and apple cider vinegar, a tablespoon regular. Do this regular, and you'll see what you feel. And sure enough, within a week or so, he comes back and he looks totally different. And he's like, wow, this stuff works great. I'm like, I keep telling you, got to listen to Brightside Ben. So,
that's a great story.
Yeah. Another thing that's even interesting, a little bit different off subject, but similar to what you sometimes talk about. It's religion and spirituality. So I've been listening to your show since October of 2011. I'm 41 years old now.
Oh, wow.
Learned a lot. And, by listening to you and breaking down the medical model, I was able to compare the similarities of my religion and actually have been able to help me to break away free from my religion. And knowing that there's a lot of similarities to the medical model dogma to religion dogma to yes. And
so, what religion? Can I ask you what religion?
Yeah, Jehovah's Witnesses.
Okay, gotcha. So there's a lot of dogma. There's a lot of dogma associated with it. You just have to accept things. You don't have to question. You don't question anything.
Exactly, and just like the medical model comes out with their JAMA and their journals, right?
Yeah.
Well, my religion would come out with their journals, and you listen to the journals, and you exactly, and you accept it for what it is. But when you start breaking it down scripturally, it's it's not exactly what it says. So that was just separately. So so
that's awesome.
Good work, man.
Critical thinking.
You do good work.
It's about critical thinking. It's about not accepting things just because you're told, but just diving deep and asking questions. You never want to just trust authority, no matter who it is. You always want to ask questions. They want you to trust them. They want you not to ask questions. And it's not just not just religion. It's also government. All the stuff that's going on with the government. You're not supposed to ask any questions. Just do as you're told. Critical thinkers don't like doing as they're told. Yeah. All right. Good for you.
Right there, what you would say, authority, the author. You be the author of your own.
You be the author.
History.
Good for you, Graziano.
And
awesome.
I'm not for vaccines either.
Well, I'm glad you can. Well, of course, now you're a critical thinker. Good for Good for you, man. Thanks for calling. Appreciate it. Take care. Have a good day. All right. Let's go to Carl, the Truth Raider. What's up, man? How you doing, Truth Raider?
Good morning. I'm hanging in there pretty good. A little sniffle here this morning, but I guess that's typical for the springtime. I want to talk about an expired medication. I think there's two of them that were one and the same, but they had different brand names. One was Vioxx, the other was Celebrex.
Vioxx.
Yeah.
Vioxx.
Yeah.
They took that one off the market, right?
Took it off the market. I don't know. Some people were having some type of a cardiovascular or something to do with blood flow, and it inhibited blood flow, and somehow I don't know, it relieved pain really well. But then
it works like both of these drugs are they call them non-steroidal anti-inflammatories. They don't work like steroids. They work with a part of the body, a part of the hormone system called prostaglandins. And the problem is, when you knock out these prostaglandins, or when you manipulate these prostaglandins, you can't just affect the joints. You're also going to affect the heart, which is dependent on prostaglandins, and the vasculature. That's the problem with drugs, is you can't just target one system. You target an entire range of biochemistry, and that's where side effects come from. That's why they took Vioxx off the market. I think you could still get it as an orphan drug, but that's the problem with prescription medicine, Carl, the Truth Raider, and that's why I do this program, and that's why I do my presentations. You can't get better by taking prescription medicine, even though you can hide symptoms.
Silver.
Okay, we are back on the bright side. I'm Pharmacist Ben. Thanks for joining us. We're on the air Monday through Friday, 8 to 9 Pacific and 10 to 11 Central Time, and 24/7 on the archive page at brightsideben.com. We've got a search engine up. All the longevity products are up as well at brightsideben.com, pharmacistben.com, and criticalhealthnews.com. We've got videos, interviews, blog posts, lots of good health information, always free. brightsideben.com, criticalhealthnews.com, and brightsideben.com. You can also sign up to join the Brightside Ben team from brightsideben.com, pharmacistben.com, or criticalhealthnews.com. And also, don't forget to take a look at our Truth Skin Health products, all formulated by myself in my compounding pharmacy for helping folks deal with acne, eczema, rosacea, skin health problems, as well as preventing post-surgical scarring. Never any preservatives, fragrances, fillers, waxes, emulsifiers. Nothing your skin doesn't need or doesn't want in any of our Truth Skin Health products. Health equals beauty. Healing equals beauty. And that's why we have 1,700 plus 4- and 5-star reviews, which you can check out at truthreviewed.com. That's with a D, truthreviewed.com, truthtreatments.com with an S, truthtreatments.com if you want to purchase any of our Truth Skin Health products. Truthtreatments.com, truthtreatments.com. All right, I'm looking forward to speaking to our guest today. Dr. Jack Zamora is an oculofacial plastic surgeon and a pioneer in plasma treatments as well as stem cell technology. He's the creator of lots of different interesting ways to tighten and rejuvenate the skin. And he's also going to talk to us, hopefully, a little bit about his thoughts on the COVID vaccine. Please welcome to the bright side, Dr. Jack Zamora. Hey, Jack.
Hello, Ben. How are you?
Good morning, and welcome to the bright side. So you're a stem cell expert. You work with stem cells, and we hear a lot about stem cells. First of all, what exactly are stem cells? And then how can we apply them for rejuvenation and facial beauty?
Well, the primary purpose of stem cells is to probably control immune modulation. And there are cells that are found around the body, in the bone marrow, in our fat, and they're also found in birth tissue like the umbilical cord or placenta. And we've been using these to create our cosmetic products over the last few years, stem cell-based, exosome-based, and conditioned media-based beautification products derived from the umbilical cord. And it was a year ago that we shifted focus when this novel virus came out, COVID-19. So we've been working on that for the last year and have produced an IV, umbilical cord-derived IV stem cell medication to treat COVID-19 patients.
Wow, so there's a whole bunch there. Let's break this down a little. Let's break this down a little bit. So first of all, I didn't realize that. So you're actually using stem cells to boost the immunity, to boost the immune system for folks who are dealing with COVID. That's fascinating on its own. So let's hang on to that thought because I definitely want to get to that. But like for the layperson, what is a stem cell?
So a stem cell is a cell that's found in our body, and the cell can do two things. It can divide and become a new stem cell, or it can differentiate and become new collagen or new bone or new skin, new tissue, basically. Those are the two things stem cells can do.
So stem cells can make new stem cells, or they don't make the collagen themselves. They make the cell that makes the collagen, correct? Correct.
They can become cells that make new bone or new muscle or new tissue.
Got it. So obviously that could have a lot of applications. But how does that relate to an exosome? And what is an exosome?
So an exosome is a protein that comes out of a stem cell. And so the stem cell will secrete these little exosomes that contain protein. And stem cells will also secrete cytokines and other inflammatory modulator products that help in the healing system or the healing response, or in this case, in the rejuvenation response.
So stem cell will send out a little exosome, and inside that exosome is various signaling proteins that kind of tell the other cells what to do?
Exactly. Little signaling proteins, mRNA proteins, things of that nature.
Oh, you said mRNA. Now that's kind of interesting right there.
Yes, that is.
Right? How do you think that relates to this virus?
Well, that's a great question. So, I'm the CEO of the company, so there's so many things I can't talk as now.
I see. Okay.
But with respect to the virus, mRNA is being used as a product to be used as a vaccine for the delivery of the information on the spike protein. So we are in the world right now. The vaccines are derived or made from these mRNA protein particles that are being delivered into our arms to pretty much carry forward the information related to the identification of the spike protein, so that if we have a vaccine and our bodies have been introduced to the spike protein, the body can then recognize the spike protein and create an immune cascade, an immune response, so that we will hopefully have less death, less hospitalization, and less symptoms if we happen to become infected with COVID-19.
So the exosome itself is a carrier for information. Isn't that kind of like a virus?
Well, the exosome itself is a nanovesicle that contains proteins inside of it. The virus is a protein that could be found inside of a cell like that, and so the virus is mostly a protein product.
Isn't that the same thing as an exosome, though? What exactly is the difference between an exosome and a virus? They sound very similar to me.
They do sound very similar, but the exosome, well, it's kind of like a cell in a virus. A cell is something that has a number of working elements. Exosomes are one step down from that. It doesn't have a nucleus.
It's not as complex.
And viruses are one step down from that, where a virus is intended to primarily drop off its protein into the body to try to replicate itself. That's it. Very simple. It's a little like a weed.
So you're using these stem cells and these exosomes, which have signaling properties and growth-inducing properties, cosmetically.
Correct. The products that we use are intended to improve the appearance of fine lines and wrinkles and beautification on the cosmetic sector. Are they injected or are they used topically? These are used topically. We have other products like Allerex that is injected IV to treat COVID-19. So and the formulations are very, very different. Okay, so I want to talk about that when we come back from our break. We're going to get to commercial, but before we get to that, you're saying that you can actually apply these stem cells and these exosomes in a cream or in a lotion topically and get these growth-inducing benefits? Well, we don't say growth-inducing benefits, but we do say beautification benefits.
Okay, beautification, anti-aging benefits. Okay, so somebody could buy a cream, a stem cell-containing cream. Is that correct? Is a stem cell-containing cream that you can actually apply topically like an ordinary anti-aging product?
That would be your healthcare practitioner, your esthetician, your nurse esthetician, your cosmetic surgeon, plastic surgeon can apply these beautiful products onto your skin either before or typically after a microneedling radiofrequency type of treatment or a plasma treatment to help improve the appearance of your skin. And then at home, you can take a non-stem cell or a stem cell derived product like conditioned media and use that at home.
Okay, so the conditioned media is very interesting to me. We'll talk about that when we come back from our break. And then I also want to talk about as much as you can, about your treatments for COVID. And then also, you told me something very interesting about the vaccine and fillers. I want to get to that when we come back from our break. Dr. Jack Zamora is with us, oculofacial plastic surgeon and pioneer in plasma treatments and stem cell technology. More with Dr. Jack Zamora on the bright side right after this. Okay, we are back on the bright side. We're talking to Dr. Jack Zamora. His website is jackzamoramd.com. You can also check out his stuff at vitrobiopharma.com. vitrobio.pharma.com. vitrobio.pharma.com. Dr. Jack, you said a whole bunch of stuff before we went to break. What is conditioned media? And you're saying that people can apply this conditioned media in a topical product. Can you tell us a little bit about that?
Correct. As we are growing stem cells in the laboratory or fibroblasts in the laboratory, the cells are secreting these growth factors and proteins that have been found to be very useful in improving the appearance of the skin. And this has been around for many years, but nowadays we're making them primarily from the umbilical cord stem cells. And it's interesting. Some of the data regarding early work with this product indicates that this may end up becoming a therapeutic product with a little bit of modulation in terms of treating skin cancers and those kinds of things. But for now, we're using it primarily for just skin rejuvenation.
How about for burns or for trauma? How about for burns or trauma?
Yeah, we have other products as well that are being used. Those are placental-based. Or placental-derived products, and it's incredible to see the direction that our world has taken, and really the doors that are opening because of COVID-19.
Well, that leads us to our next question. Some of these applications you can use for boosting the immune system, for literally treating COVID or for preventing it?
So right now, the FDA has authorized us to do two things: use our stem cells for compassionate use, meaning patients who have failed everything else, and number two, to initiate our own clinical trial for the use of stem cells to treat COVID-19. And so if you have COVID-19, you can have all of these symptoms, and it appears as though the administration of these stem cells into your veins, IV, end up going directly to your lungs and start turning off the cytokine storm.
Stem cells are anti-inflammatory themselves, or they modulate the immune system themselves?
Exactly. Anti-inflammatory sounds like it's just turning off the inflammation, whereas this is really controlling the inflammation. And that's the mechanism by which we believe that the stem cells are helping those sick, severe, and almost morbid COVID-19 patients. Secondly, we believe that the long-standing inflammatory insult from COVID is responsible for the symptomatology that the long COVID patients have. Up to a third of patients who have experienced COVID will end up having these long COVID symptoms of brain fog, significant systemic inflammation, joint inflammation, all of these random inflammatory diseases or the symptoms. And we believe that the IV stem cells may be the way to treat these patients for a long time.
So the implication is that you can get general salubrious effects, health-promoting effects, by injecting stem cells. Is that correct?
Correct. We have some IRBs outside of the country in the Cayman Islands, and these studies are everywhere. But the idea of using stem cells for anti-aging has been well described. And aging is nothing more than inflammation. And if we can control inflammation, then maybe we're controlling the aging process.
So the main mechanism of action of the stem cells is anti-inflammatory?
Again, it's
modulating the immune system.
Yes, immune modulation.
That's the main mechanism of action, is to work with the immune system. That's
Correct.
how the stem cells.
That's most likely the main mechanism by which all of these wonderful things are happening.
Is the implication there that aging itself is an immune system phenomena?
Yeah, that's what we believe. The accumulation of inflammatory products is ultimately the cause of Alzheimer's. That's probably the best recognized endpoint disease process of aging, correct? Same thing with macular degeneration. Age-related macular degeneration is nothing more than inflammatory processes that end up destroying the natural structure of the back of the eye. And so we're able to help control or modulate the immune response. Maybe we can slow down the aging process, or maybe even improve the aging process. And we already know this with our exercise and nutrition. Typically, those things are intended to decrease our natural levels of inflammation. Exercise decreases inflammation, and proper nutrition decreases or controls inflammation. Conversely, bad nutrition increases inflammation, which possibly increases diabetes, possibly increases hypertension. So the next question is, are these disease processes that we're seeing are just labels to the symptoms of inflammation? Is hypertension an inflammatory disease? And COVID is showing that it might be. Is diabetes an inflammatory disease? Probably. Is then control of the inflammation going to control diabetes and hypertension? Interesting questions to ask that hopefully we'll be able to answer in the years to come.
Well, theoretically, what alternative mechanism could there be that's not inflammatory? It has to be, I would think.
It most likely is.
Well, what else could it be? I can't think of anything else, right?
You're right. I mean, it's hard to come up with other. I mean, there's other things that can happen, but for the most part, if we were to simplify it and just try to put it into one simplistic picture, then we start to realize how complex of a word inflammation is.
That's true. That's true. But when you boil it down, inflammation is a defensive response. So all aging, all disease, all things that we hate about being in our bodies are the result of a defensive response, or an extreme defensive response, would you say?
Or the inability to control that response anymore.
Right, an out-of-control defensive response.
Exactly. I mean, that's truly what cancer is. When we can't control the number of irregular cells through our normal immune system, then the cancer cells start to replicate.
Have you used this for cancer, this treatment?
Not directly.
But it seems like it would work, right?
Yes, very, very much so. It should work.
How about for neuropathies and pain?
We have seen we are doing some preclinical work on neural regeneration. And so, yeah, it's interesting. That's a second part of the equation. The first part is the immune modulation, and the second part is regeneration. Can we regenerate or help in the process of regenerating tissues with the administration of stem cells? And I mean, that's a whole other beast. And I think so. If you take a mouse and you traumatize a mouse with a traumatic brain injury and then inject stem cells, the mice who had stem cells injected to a certain part of their brain had improved neuronal reformation as compared to mice who didn't. And then that was tested both clinically, in the sense that these mice were able to improve their scores in running through a maze, and also we were able to see significant improvements in their regeneration of their neurons when they were sacrificed and studied. So there's
dementias and Parkinson's.
So we're working on that. We're realizing we're actually working with another group here in Colorado named Seroscan, and it's phenomenal. What they did was they took all of these images from CT scans and MRIs and applied SPECT scanning, which involves the ability to measure the blood flow to the brain, and they were able to identify 120 different parts of the brain that are maybe subject to different levels of blood supply that may also cause different types of symptoms. For example, there was one boy in California who was diagnosed with schizophrenia, and SPECT scanning actually found out that he was suffering from carbon monoxide poisoning because his SPECT scans seemed to mimic carbon monoxide patient SPECT scans. And sure enough, upon further investigation, his home life was one where he was subjected to carbon monoxide because of his the vent system in the house. And so this is an incredible time in medicine to know that that there are going to be some pretty impressive changes moving forward in the way we evaluate disease and the way we treat disease, kind of because of COVID-19.
Doc, I wanted to get to the vaccine and the fillers. We're not going to get a chance to do that, but okay. I'll have to talk. We'll have to have you back on. I appreciate you coming on the bright side. Thank you so much, Dr. Zamora. We'll talk soon.
You bet, Ben. Thank you so much.
All right.
Bye-bye.
Take care. VitroBioPharma.com. VitroBioPharma.com is Dr. Zamora's website. Also, JackZamoraMD.com. JackZamoraMD.com. That's all the time we have for today in the bright side, friends. Thanks so much for listening. I'm Pharmacist Ben. Have a wonderful, beautiful, awesome, spectacular day. We'll talk to you later, folks. Bye for now.